Hi, my name is Elliott. I'm president of Granite Health Solutions and a registered physiotherapist. My background is I worked in clinical practice for 5 years and then started managing a private practice in terms of providing third-party medical assessments for WSIB, motor vehicle accident claimants, and government organizations. I think the answer to that question is yes and no. Leading in healthcare is very similar in many ways. First, you have to have a very large strategic outlook when you're dealing with claimants, business professionals. You must have a strategic mind. You must be able to motivate and engage your employees. You must be able to have innovative and thought leadership. But in healthcare, there is another dimension. And in healthcare, what's very important is to ask a very pertinent question. Are the decisions that I'm making today going to affect the healthcare and well-being of my patients and clients while also focusing on return to shareholder value, profitability, and revenue? In my practice as a physiotherapist, I've had many dealings with this particular conflict. I was often asked to treat motor vehicle accident claimants. These claimants require a great deal of care and rehabilitation, and often a great deal of revenue is produced by these individuals for the clinic. I had a patient that was unable to attend 3 appointments in a month, and this was because she was attending the care of her terminally ill mother. At the end of the month, my clinic director asked me to review the billing for that month and asked why I hadn't billed for these 3 appointments. We called them no-shows. Now, no-shows, in general, are up to the individual physiotherapist to determine if they are going to bill for those appointments or not. I explained this to the clinic director and explained that I had not provided the service and that, in my opinion, I did not feel that it was warranted for me to bill for these services. The clinic director turned to me and said, "Ian, you're going to find that in physiotherapy, it's 50% business and 50% ethics." The next day, I returned back to the clinic and told her that I 100% quit. And I think that most healthcare professionals are going to find themselves in these complex situations where they must balance their professional obligations as regulated health professionals, abiding by their healthcare rules and policies and procedures, while also dealing with the individual private practice's core values, procedures, and policies. And every single problem will have to be dealt with from a different perspective. In my experience as a physiotherapist and in my private practice, in the current business that I'm in, I must deal with multiple professionals, physicians, surgeons, psychologists, psychiatrists, while also dealing with shareholders, business professionals, administrators, and often it's a challenge for both sets of parties, business professionals and healthcare professionals, to really interact and understand each other's obligations to their individual colleges as well as to their shareholders. So it's very important to understand what motivates each professional. Is it career advancement? Is it professional practice? Is it a duty of care to their client? Is it profitability? Is it revenue? Is it return to shareholder value? And I find that it's very important for all parties to communicate, to understand exactly where each party is coming from, and to come to a common consensus about what's the best thing for the business, which includes care of the client as well as care of the overall business. There are many common skills. As a business professional, it's very important to have a good strategic outlook on the overall business, have a good sense of the business fundamentals, to also be able to engage and motivate your teams. From the healthcare perspective, there is also another dimension. From healthcare, a question that must be asked is, are the decisions that I'm making today in terms of profitability, revenue, return to shareholder value, are they going to affect the healthcare of my patient and client? Or in another way, is there a trade-off between optimal care and profitability? I've seen a lot of changes in healthcare, and I do have some concerns about the sustainability of our healthcare system. In particular, right now, physicians continue to be the gatekeeper of most medical services. There are physiotherapists, chiropractors, registered nurses, nurse practitioners that are developing the skills to help alleviate some of the strain on our healthcare system. And I think that more needs to be done to allow some dissemination of roles and responsibilities between physicians and other allied healthcare professionals.